Welcome to the January webinar, a collaborative presentation of the Federation for Children with Special Needs and the Recruitment Training and Support Center. I am Mary Beth Landy, the Training and Support Specialist at RTSC. Today's webinar, Creating Healthcare Independence for Youth on IEPs, is presented by Pat Nemia. Pat is the Project Director for Mass Family Voices Family-to-Family Health Information Center at the Federation for Children with Special Needs. The goal of Mass Family Voices is to assist families in making informed decisions about care for their children and youth with special health care needs. Pat is a licensed physical therapist and spent many years in clinical, administrative, and educational health care. Welcome, Pat.
Thank you.
During the webinar, you'll find a question and answer button on the bottom of your screen. Please type your questions into the toolbox and we'll try and answer them during the presentation. Past webinars are archived on RTSC's website, along with many resources on trauma, learning, and educational issues that impact students and child welfare.
Thank you. Good afternoon, everybody. I'm happy to be here, and I'm happy for your interest in healthcare and how healthcare transition can be considered part of the IEP transition process. So as Mary Beth said, my project here at the Federation is Mass Family Voices. So I am one of the projects at the Federation for Children with Special Needs. I think you're all pretty well acquainted with the Federation and what we do, but this slide just gives you a little bit of an overview of the impact of the Federation on families across the state of Massachusetts. Who we are, who I am, Mary Beth said a little bit already, is I'm part of Mass Family Voices. Mass Family Voices is a grassroots organization. It is part of the national organization Family Voices that works with families surrounding the needs of their children with special health issues. We, as part of Family Voices, try to take family stories and bring them forward to impact policy, legislation, and change for families surrounding the healthcare venue. I'm funded at Mass Family Voices through the Family-to-Family Health Information Center, which is a federal grant. There are 51 across the country. And I will go to the next slide. This kind of gives you the information of the services that the grant offers. We have a toll-free number. People call all the time with health-related questions, particularly questions with regard maybe to healthcare access, healthcare finance access. I run an annual conference. We run webinars. We do workshops across the state. And in particular, one of the things I like to highlight is that we have a Mass Family Voices listserv. And the listserv is a great opportunity for families and professional partners across the state to come together, ask questions, provide solutions. Families get a tremendous amount of information, as well as professional partners asking families questions about their experiences. So if it's not something that you're familiar with, I encourage you just to look at that. So onward, I'd like to talk a little bit about the goals of the workshop today. And so the title of the workshop, Creating Healthcare Independence for Kids who are on IEPs, one of the ways that we're going to do that is through the healthcare transition process and looking at the intersection of healthcare transition and the educational transition process. And so in the beginning of this, you're going to have to bear with me because I'm going to talk a little bit about healthcare. And while I understand that a large portion of this population that I'm speaking with is really involved with educational decisions, the information regarding healthcare and this information that I give you today, I hope you'll see how it will impact the educational decisions that you need to make, how it will support them, how it might even in some situations change them or enhance them. So we're going to, the goal of the workshop is first to look at defining or developing a working definition of what is healthcare transition. And looking a little bit at the historical perspective of it. I think it's always really important to understand the context of something that you're discussing. We want to understand what are the barriers in the healthcare transition process. And then with that information, how do we use tools that will facilitate a child's health transition, How can we incorporate skills for healthcare transition or creating independence in healthcare into the IEP? And then really think about what are the consequences to kids that have a poor health transition at turning age 18. So on we go. And so this is kind of my soapbox slide. I like to use this slide and to kind of say to people, healthcare is the basis of everything. You know, without good healthcare, without an understanding of good healthcare, without an understanding of what a child's healthcare should be, we really can have the best IEP in the world, but it's not going to work. Or a child can have the best transition in the world into a workplace or post-secondary education situation, and things begin to fall apart because the basic things that they need, good health care, and the parts of that, if they fall away, everything else will fall away also. So I like to say we're the pillars supporting successful transition in all other areas. So take a step back because I find that people have very different definitions of who is a child or a young adult or youth who has a special health need. Many people will think, oh, you're talking about people who have very medically complex situations or chronic physical illness. And that's not really, the definition is much more encompassing than that. And so I use the definition that's presented by HRSA, which is the federal government, and they explain who they are in this slide. But what they say is, and I'm going to read it, those children with a special health need are those who have or at increased risk for a chronic physical, developmental, behavioral, or emotional condition, and who also require health and related services of a type or amount beyond that required by children generally. So I would say this pretty much takes into account all the kids or most of the kids that we're seeing who are on IEPs. And really it's only if they require, they're considered a child with a special health need, they may only require one health service that is not necessarily seen in a typical or seen needed by children generally. So it's a definition that takes into account many, many children. And I think we should remember that because sometimes people say, oh, but they don't really consider me, you know, part of that group, and you are. So understanding the definition of a child with special health needs, we'll talk a little bit about what healthcare transition is. And I put these two up here because they talk about both sides of the same coin. You know, healthcare transition seems like a very simple concept, right? You're young, you're under 18, you see a pediatrician. Then you're over 18 and you see an adult physician. And so the transition is the process of changing from one to the next. It seems very simple, should take place, no issue. But there's a lot of problems that happen with it. And so I put in the second part of this healthcare transition definition, which looks at it as a very complex and dynamic phenomenon. It involves skills, coordination, and education of parents, families, clinicians, and caregivers. So it's not so simple as picking up the phone and saying, okay, I'm moving from this pediatrician to this adult healthcare situation. Kids with special health needs have been on medications for years. They've had multiple health providers, and finding a really good fit for them in the adult arena is very, very important. And first in all this is making sure that the transition takes place, which is the most important thing. But then also finding the right fit will be very important. And as we go on, we'll talk about what some of the barriers are to that for kids in trying to make this transition. So I want to talk a little bit about the historical perspective. You know, when you bring this up, people say, healthcare transition, is that new? I've never heard that. Or is that the new buzzword or new thing? And not really. It's been being talked about for many, many years. And so the first person to really bring it to the forefront was C. Everett Koop, who was the U.S. Surgeon General in 1984. And what was happening was in the 70s and 80s, what was being recognized in healthcare is that children who were born with disabilities, who had usually died before their 18th birthday, were now living into adulthood. So medical advances were sufficient enough that children were living longer, and they were saying, well, now what do? We don't necessarily have the specialists to interact with these kids and provide good health care. So he was the first to really recognize this. And in 1989, he pulled together kind of a national conference. But what was important about that was the beginning of where really a federal agenda was set forth to say we need to develop transition health plans for kids who have disabilities. Now, I think when he was looking at it in 1984, they were talking about children in categories such as Down syndrome, who potentially had significant cardiac disease and perhaps didn't live longer than 18, children with cystic fibrosis who were not living longer than 18. And so they were looking at a little bit more of this chronic medical. And probably because we really hadn't, and Mary Beth, you can speak to this too, I think we really hadn't come into a place where we were diagnosing a lot of kids and really providing treatment for kids who have mental health disorders.
Yes.
And so, you know, while he identified it with a certain population, this concept certainly applies to the fact that we are now making new diagnoses with kids. We're seeing that they need help. And this is probably, you know, maybe the first generation, or we're now beginning to see these kids move into adulthood. And I think that the amount of children moving into adulthood who have received intervention as kids is going to be increasing steadily. And so we have to think about how's that done successfully.
Yeah,
So,
I agree with you. I think that in the past, the diagnoses weren't made until people were adults. So that it was a very difficult transition time for them, just because they weren't receiving any services.
Right.
And it was considered a behavioral issue. So it was complex on top of that. I do think that we definitely have moved into a generation where we are starting to look at what is happening, what has happened to the child, you know, what is underneath the behaviors that seem to be going on, so that we can diagnose them if necessary at a younger age.
Right.
And then from there make a more educated decision as to what the next step is.
And then on the healthcare side, you know, pediatric offices, whether, you know, it's pediatric psychologists, psychiatrists, pediatricians, tend to be much more nurturing environments. And so it can be a shock to the system when kids move from a pediatric to an adult situation, because you go from this very nurturing environment to an environment where you're on your own. It's, well, aren't you the adult in the room? Then you need to be able to handle a lot of this yourself. And that's where the transition becomes so important. So the idea of healthcare transition, like we said, began in the 80s. And then pediatricians began to come on board with this. And in 2002, the American Academy of Pediatrics developed a consensus policy on transition. And in it, it was these academies of physicians, if you don't know, are groups of physicians within certain specialties. So it was the pediatrics, the Academy of Family Physicians, and the Academy of Internal Medicine. And so they came together saying, we're probably going to be the players in this idea of healthcare transition. So what do we need to do? And so in 2002, they put forth this policy, and they said, okay, the goals of the policy is that by 2010, everybody's going to understand in the physician arena what healthcare transition is. And beyond understanding it, they're going to have the skills and knowledge to facilitate it. So they're going to know what they need to do. We're on board. This is going to happen. It didn't really happen. But, and why? So this is very different from educational transition, where there are laws that regulate what must be done and what you should be accomplishing it. There are things, you know, through the IEP, you can evaluate whether or not these things are being accomplished. There aren't any laws that regulate healthcare or healthcare transition. There are policies, there are best practices, but there isn't really, if a physician maybe doesn't participate, that's their choice. So it's a little bit harder to move the needle on the healthcare side in making this policy really effective and making it consistent across practices.
Mm-hmm.
So as I say here, have things gotten better since all of this? And really, no, they haven't. And I think there's a couple of reasons. The one I just mentioned, that it's not regulated by some kind of law. And I think, so what we did find, there have been a new statement that's been put out, and the link is down there for the American Academy of Pediatrics, and they looked at how many kids actually do receive anything with healthcare as far as transition, and the number they came up with was 15%. And that's pretty low, and that included all kids. So nobody's getting information about how to effectively move from one situation to the next. And when we looked at the numbers in Massachusetts, and I don't have the exact, but it was somewhere between 16 and 17% when we looked at number of kids with kids and youth with special health needs. So it's still very low. So this is not happening. So there's a concerted effort, but we don't seem to be moving the needle in practice yet. But, what's next? Can families be optimistic? And they can. I believe that, there's a huge federal effort. There's an effort by the National Academy of Pediatrics and the Academy of Pediatrics here in Massachusetts to really move forward and to establish a structured healthcare transition policy that, that helps all kids and all diagnoses. So,
can I just interject one quick question? Do you find that the new guidance regarding screening tools for particularly pediatricians for mental health and depression has helped in any sense with this? Is it helping to increase the number of kids that are at least being recognized?
So I think that the screening tools may be helping with that. Again, I think, like anything, it comes down to individual practices and how effectively they use the information that they have gotten. And we know it's like across school districts, across medical practices, they will be more tuned into things than other practices. So I think, that's something, when we talk about listservs, or, that's a common question we see on the listserv with parents. I'm looking for a physician that would, or has dealt with patients or does screening for effectively, and families do get answers from other families. And I think that is the way that, or similar activities such as the listserv, are the ways that you connect into the right healthcare situation for yourself. But I think it can be, if you can not be quite sure. You can have a wide variety of how effectively something is utilized. I think certainly there is an effort in that arena for physicians to be more aware and to be using the screening results. So I do think that there is much more of an effort to identify the kids and to work with the kids. But again, that remains in the pediatric situation. And so the big situation becomes, how do we continue it and move it along?
Mm-hmm.
So when we talk about, so what I've kind of talked about, and I know everybody kind of glazes over all of this historical perspective things, but it's important to understand where healthcare exists on this, because as a parent, as an advocate for these kids, you need to understand where you're going to get help, where you're going to get information, and where you're not, and maybe where you need to be the change agent in the situation. So healthcare is trying. I'm not sure they really are the effective change agent currently in helping kids make this transition. And so others may need to think about, okay, maybe I can force or utilize tools to make this transition happen more effectively for kids. So when we talk about the barriers to transition, and this is a little bit of an older article, but they all pretty much still exist. And the biggest one by far is always that there's kind of low expectations for kids. That, well, they have all this healthcare stuff, they're really probably not going to be able to take care of it, but the expectations aren't there that they can be a participant in their healthcare. And I think what we first have to recognize is that they can be, to some capacity. Maybe there's a range of independence, and you want to reach that highest level possible with any child. And so you have to look at it and say, okay, what part can they take in this? And so one of the big things that I think people can do and we'll talk when we talk about developing skills in the IEP, but is looking at, you know, a child and what they can accomplish as far as their health care is concerned. What can they advocate for themselves? What do they know about themselves to self-disclose, and how will that help them in jobs, in schools, and that type of thing. So the other thing that happens a lot is that, and you can read through these, but I'm just going to highlight some of it. The other thing that happens a lot is that people become so comfortable in their pediatric practice that they're begging the pediatrician to let their child stay with them, or maybe it's a pediatric counselor, please can't you, you know, keep working with my child. And, you know, there's a lot of things that may work for a little while, but I think there's other issues. You know, there's issues of self-esteem. You know, this child is now an adult. You're an adult. You need to kind of move into the adult world. And people who work in the pediatric setting are not really versed in some of the problems that are going to come up in people's adult lives. And so it is very important to make that transition into a situation where someone who understands an adult population is working. So,
and I think there's some pediatricians who are prone to want to keep that population. I know, for example, my kid's pediatrician, who is absolutely wonderful, but will see the kids through college.
And I think that's a time frame where maybe a lot of people maintain what they have. And I can see that as working, as long as it's part of a plan, as long as it's not the only plan. So, you know, we're not going to switch a million things. This child's now going to college. There's a lot that comes with that. So, you know, potentially we stay. We let this pediatrician work with them. They know them well enough that they can, you know, right out of the gate, speak with the college or the nurse, or if it was necessary, and say, wait a minute, these are the situations. But it has to be part of the plan for where are you going next. So as long as you're working towards that plan and it's on your radar, then I think it's fine. You know, but you have to break the tie sometimes. Some of the other issues that face transition are, and this is always, you know, difficult, but it's there, is that there's not a lot of reimbursement for physicians to sit down and spend a lot of time talking with people, physicians, psychologists, any kind of health provider. I know as a health provider, there was no box to check for long conversations with family. You know, it's not part of treatment. And that has become a little bit more narrow for physicians. And so, you know, it's just something that drops off the radar. And maybe they say, well, if you want to talk to the social worker that we have in the group, or maybe, you know, you could talk to the nurse practitioner, but it's not become part of their planned treatment. And I think that's something that people are looking very closely at right now. You know, how do we make it part of reimbursement packages, or how do people get to spend this time with families, you know, with young adults, so that they can make the right choices going forward. And another, you know, big issue that we have is lack of just family care physicians in the state of Massachusetts, across the country, but in the state of Massachusetts, there are just not that many adult care physicians. It's not the practice of choice. People choose to become orthopedists and surgeons and neurologists, but there are not as many who are entering into the family practice arena. So that is also a difficult barrier. So what do we do? What do we do? Why do we need this? What do we do? It seems like an impossible situation to fix. And it's not an easy situation to fix, but there is a part that we can all play to potentially move it forward. Understanding the goal is just to have, you know, your child, whether you're an advocate or a parent, move and have a plan to move into an adequate situation as an adult. So the good news is that, and we've talked about these positive, there are a lot of positives out there. I think this slide is a little bit more applicable to when I talk to families of kids who have some physical disabilities, but we've already discussed this. The good news is more kids are being diagnosed early. More kids are getting treatment early. We're doing, well, I'm not, you are, doing tremendous things with, you know, children in this, you know, in the population, you know, that the SESPs and foster parents and all are working with. you're doing great things, but then everybody tends to, be done at 18. So it's really important that all this work that we're doing continues somehow. So we look at who's involved in this, and this is your healthcare kind of group that is involved in the process of transition. And what has really happened is that rather than having transition that encompasses everything that a young adult with special needs needs to think about, we have almost silos of transition. And in particular, we have educational transition and we have healthcare transition. And right now, the two don't meet. And when we are able to forge some intersection, I think that's when we become more successful. But in this, which is healthcare transition, certainly parents, guardians, SESPs are part of this circle and part of the people who need to participate in what is going on in a child's healthcare. I think participating in healthcare and making healthcare decisions are two separate things. People get nervous and they say, I do educational, I don't make the healthcare decisions. I don't advise on healthcare. And certainly you should not be advising on, what treatment methodologies or that type of thing. But conversations about things like, have you been making your doctor's appointments? What are they? Is there anything in particular that's come out of these appointments that you think is important for me to know, the school to know, are important things for an advocate or a parent to have when they're sitting at a meeting and talking about IEP goals and transition goals. So you're part of the group. So this slide is always kind of interesting for me because I'm never quite sure where to put it. So I just kind of throw it in at one point and say, just so you know, transition should be happening across a child's lifetime. If a child has a diagnosis that they're basically going to have for their lifetime, we talk about kids with cardiac diagnosis. They can be healthy for a large portion of their lifetime, but they still carry that diagnosis with them. There are things they have to consider, interventions they have to consider, appointments, screenings, things like that they have to do. And so it's really important that this is part of who a young child and then young adult and adult is. That it's part of kind of their everyday conversations. So that it doesn't become a major project. It's something that they understand, that they're coping with, dealing with, and living with. And that makes all the transitions much easier. So the American Academy of Pediatrics states that they would like transition to be at 12 years. I say to people, if nothing has been discussed about healthcare transition and you're working with a child or you have a child who's at age 14, that's the time you should start to be thinking about some of the things we're going to be talking about going forward. So if at no other time, 14 should be your hard stop. Where you're starting to talk about educational transition, you should be bringing some of these other ideas in. Okay. So before I talk about what we can do, I'd like to say, and if you don't, but why bother? This is all really nice information, and gee, maybe I never thought of it, but really, why bother? What are the consequences to a child or young adult when we don't? And the biggest one is at 18, the age of majority, everything changes. If you're a parent of a child who's already turned 18, no matter what your situation, whether they're a child with special youth, as a child or youth with special needs or not, you know that life becomes very different when your child turns 18. And so, I think about kind of different buckets of kids, but there are kids who will have medical complexity or significant disability that their parents will always be involved, or guardian will always be involved in their health care. And that's probably the group that goes, the guardianship route. And so that's helpful, right? That's going to be helpful with anything because you're always going to have a representative there who has your best interest at heart helping you through the process. It's the other groups of kids, the ones who have maybe mental health issues or diagnoses that when they become 18 years old, it gets a little murky because no court is going to say, well, maybe your parents should make all these decisions for you. And so that everything now becomes their responsibility. And I can't tell you how many times families talk to me about the fact that their child says, well, finally, it's my decision. I'm not doing it anymore.
Mhm.
And that's a huge issue. I mean, as a result of that, you have lapse in continuity of care. You can have lapse in healthcare insurance. And I didn't write this. I don't know why I have the 2 in there. I think I was thinking something else. But, you know, when you talk about, tell me the right terminology, because I don't think you talk about this idea, concept of prison pipeline.
The school to prison pipeline.
School to prison pipeline. Thank you. I left out a number of words. But I think what we talk about is kids who are struggling. We know that kids who struggle with mental health disorders when they're young have a higher tendency to wind up potentially in trouble when they're adults. And you correct me if I say anything that's not accurate, please. And so we spend all this time with kids, as we've said, working on this. And then they walk away from their health care, whether it be ongoing therapy appointments, whether it be medication, whether it be the regularity with which they take that medication, whether it just be a touch base that they have with a pediatrician that keeps them on track. They walk away from that, and all of a sudden life falls apart. We see this with so many kids, and it doesn't, it can be a significant problem, or it's just, we see the kids, they walk away from college, they can't keep jobs, and it all kind of traces back to the fact that they've left healthcare. So it can have significant impact. And then this great, as I like to say, so then this really nice educational transition plan doesn't work.
I feel like you're talking about everything you've to help my kids with. As many people know, my kids are adopted through the DCF system. And definitely this has happened in our case. And I don't think that we as parents did a great job. I so micromanaged their healthcare needs to, you know, scheduling the appointments, dropping the medications off at the nurse's office, you know, everything, to the point that when it became their responsibility, that's exactly what happened. It's like, I can't make that appointment for you anymore. Here's the phone number.
Right.
You know, Pat just helped me get my youngest, who's 21, health insurance because she has let that lapse, and things like that. It's exactly that it is something difficult. And actually, as I'll go into later on, the number of juveniles as well as young adults who are in incarceration and with their mental health issues that are not being addressed because they've just go, you know, cold turkey off their medication, different reasons like that is a big consequence that does happen.
Right. And as we said earlier, you know, we're going to really see this, I think, in the coming years, because larger populations of children are moving towards, you know, adulthood who have had treatment and now maybe coming off of it. I mean, my own son has it's kind of a complicated, he has some very complicated language disability, and he has anxiety and a number of things that are surrounding that. But he was all set to go to college. We thought we picked the perfect school. It was great. And it was very difficult. It was very difficult for him. And it was, you know, kids want to be just like everybody else. And so they don't want to have, they kind of walk away from their problems. And if there's not a plan in place, life makes it easy for them to do that. Because my son had even signed a FERPA with the university, and they were still very hesitant to talk to me.
Right.
And so you may even have the paperwork in place, and they're so worried, kind of, in my situation, they were really worried about, well, I'm not really sure, maybe we should check again. And I understand the issues that the university faces, but it's not as simple as you think. And
just to clarify, what she's talking about is permission to be able to talk to the school counselors and as well as the psychiatrists at the school. I also find it's difficult when kids are going into college and all of a sudden the responsibility of disclosing becomes their responsibility. They need to go to disability services. They need to disclose to them. And then a lot of colleges make it on the student to have to go to every single professor and disclose in order to get services.
Yes.
So if they're not comfortable advocating for themselves as part of that transition plan, this becomes even more complicated. So this is an area where something like self-advocacy and self-determination are so huge, because it does affect them after this transition process.
And if you haven't practiced and learned, and we'll talk about that in a second, about exactly what your disability is, schools don't need to know everything. Not every person needs to know everything. And so understanding what it's important to tell and how to tell it in a meaningful way. I have a lot of stuff going on in school, and I never did well in math. And I, that's what we see a lot. And so, but that doesn't help the university or help the professor understand. My son has a significant stutter, and so at times can have problems speaking at all. And what we did was we worked with his speech pathologist that he had as a child, and developed a long list of things that he needed when he got to college. And it was very interesting because there were things I never would have thought of, like so many things in college. You're tested on, do you make eye contact with people? Well, he can't do that. And so these are the things we'll talk a little bit about as I go on, but it's important for your child to be able to understand and say, to the professor, this is how my potentially anxiety affects my ability, to participate in this classroom, or these are the things I might need to sit in a classroom for 2.5 or 3 hours. These are the things that could be a trigger in my situation, or knowing what of those things are appropriate to say is really important for a child to have developed. Okay. So I like to kind of skim through this. This is at the Department of Public Health, Massachusetts Department of Public Health, on the Division for Children and Youth with Special Healthcare Needs. In their resources, they have a much more detailed handout of this. And but what I like about this is it explains what you should talk to your child, or the child that you're responsible for, what they can kind of absorb and understand through their lifetime about their disability, what that conversation can be about. And I think when you look at these skills, you can start to think about, okay, I can understand how that could be part of his self-advocacy goal that he has in his IEP. I understand how this could be part of, a management or organization goal that he has in his IEP. So if we look at them, so when a child's very young, it's more simplistic in that you're talking with your child about his health, but it's a conversation that needs to begin when kids are early. It's not something that at 17 you say, okay, let me tell you what's wrong here. First of all, that's never a good way to approach a conversation with anybody about them. I mean, I think if, talk about your self-esteem taking a little bit of a hit that day. Mm-hmm. So it's the ongoing conversation to make it part of their day-to-day life, something that everybody accepts and that they can accept. And so just explaining things in very simple terms, talking about, when you're taking your medicine, oh, this is the medicine you're taking, or this, oh, remember that, get that piece of equipment, just having everything be part of daily life, daily conversation. Use the name of doctors in conversation. Don't make it, there are persons whose name they hear once a week. Have a doctor be part of their normal life. Bring that in. And that pretty much continues through age 7 through 10. You start to encourage a little bit more independence in things with your child, and taking a little bit of responsibility for different aspects of their care. Maybe have them say, okay, when we go into the doctor, why don't you have a question you want him to ask today? And so these are things that parents can do. But I also think that these are things that you can talk about when, you ask kids to talk with their teachers about things. And when you're working on those skills, why not incorporate the person who's working with them, whether it be a counselor at the school? Let's talk about when you go to your doctor too. How do you talk to him? Do you have questions? How do you figure out which question to ask him? What if he doesn't hear your question? What could you do? Mm-hmm. I think, so you're not making a health decision for them. Mm-hmm. You're not jumping into their health care and saying, now tell me exactly what that diagnosis was, and did you ask him about, X, Y, and Z? But you're talking about developing skills that apply to that situation. So as you get into the age 11 to 13, this is really where you're asking a child to take charge of their education. You're also asking them to take more responsibility for their health care. And they should be, understanding and learning, more about what their health condition means. Now they can start to understand it a little bit more in depth. You can start to, what it means to their daily life, what it means to them maybe as an adult. You can start to have these conversations with them and why it's important for them to know. Things like at this age, how do they keep their emergency information? What if an emergency happens? What if there's a crisis at school? Can they tell people what to do? If they can't, do they carry that with them so that people would know where to get it? What do they know as far as their warning signs for whatever their healthcare situation is? For a child with mental health disability, it can be some type of trigger to an event. For a child with diabetes, it's what they experience when their blood sugar fluctuates. So, but it's important for them to know what's happening to them. And then as we get older, they're really at this time, they're continuing to take charge of their health. These things that we've talked about continue, but they're just taking on more responsibility. As they're older, they can manage their own medication. That should be something that they're doing. And so maybe as part of the IEP, the nurse is pulled in. And what you're doing is you have a medication schedule that the child's responsible for at the school. And, working on that skill of being responsible for it. You're not jumping in and trying to interfere with healthcare, because I think that it frightens people. They're like, oh, I don't want to cross that line. I shouldn't be making health. It's not decisions. It's really development of skill that will enable the child to have independence in their own healthcare. And then when they're 18, time's up. It's ready for you. They're on their own. Everything is their responsibility. Nobody is going to talk to an advocate, a parent, a grandparent, unless there is some guardianship or something in place that specifically assigns that. And so they're kind of on their own, and all the decisions belong to them.
We have a question
Sure.
that I'd like to ask at this time. What would you say is the school's responsibility to assist students with their healthcare transition, particularly when it plays a large role in their ability to live independently?
So I think, say the last part of it again to me. So particularly when it plays a large role in their ability to
live independently.
Well, I think when you're talking about transition for kids, and I'm not sure if this has if they're talking about someone who's maybe a little bit more medically complex, or if these are maybe a mental health situation that is significant that would impact their ability to live independently. But I think the first thing I think you have to think about, everyone has to think about when we think about with children when we're reaching independence, is what is their ability to participate? How much? And I think, again, we don't want to set expectations too low. And so what I think, if you're an advocate, is understanding what a child's needs are that are going to impact. Is it equipment? Do they need, what is it that will impact their ability to live independently? And then so that's information that the school nurse can discuss with the physician. So the nurse and the physicians can have a good conversation about medical needs, about what the school is trying to do in transition, about what they see that would be helpful for the school to know in facilitating that transition. So I think there's always important to outreach to understand that part of it. And then again, the rest of it really becomes skill development, right? So what are the skills that they need to live independently? Is the skill that they need to be able to manage a medical regimen? Now, what if they can't, right? So we're assuming that, the way I'm talking, it's like, well, do these things, they have their organization, their self-advocacy, and they're going to be fine. And that's not necessarily the way it goes. So I think if you're planning a transition and you're saying, well, this person may not be capable in the future of ever managing their medications, then there has to be, as part of the plan in place, if they're, you know, what is the highest level of independence? It may be having to have someone with them to help them do that.
Mm-hmm.
Or having them recognize that they need someone to do shared decision making with them, or
Mm-hmm.
something as far as their health care is concerned, so that they do access all the health care that they need. Does that make sense?
Yes.
Okay, great. So let's look a little bit at transition skills in the IEP. So these are just some skills that I put up here. I think there could be many more. So I think that when you're looking at the transition IEP, and you're starting to think about, okay, are we moving towards a situation where maybe this person is complex enough medically or for other reasons that they're going to be in a residential situation, or there's going to be guardianship. So that's one group. What I'd like to talk a little bit more about today is the group that might be going to work or might be going to school. And so are really, when they turn the age majority, are going to be the ones who have responsibility for themselves. Mm-hmm. And so in thinking about that, so that's the first thing. So you know, okay, so the child is going to be responsible for themselves. As I've said, a nurse can facilitate, a nurse is part of the IEP team. Mm-hmm. They're often not included on a regular basis, and they're not included usually in transition conversations from my experience. I think pulling that nurse into that conversation is really important. Asking her, and again, this comes with parent permission, but asking her to reach out to the different providers and really get a sense of where they think this child is and what some of their needs might be, so that they effectively continue their care. You're not looking for information about, you know, what meds are they going to take when they're 27. You're looking about what does their care look like so that we continue it. Mm-hmm. And so I think that's a really important first step. If a child is receiving services in school, related services like counseling or speech therapy or OT, those are health providers. And so they're providing, while it's in the school, a health-related service. Mm-hmm. And so it's easier for them in those situations. Sometimes people feel more comfortable with them incorporating some of the skill building into what they're doing because they're kind of already operating in the health arena. But I think some of the organizational skills that you may already be working on, we talk about, you know, so kids who are going to be going to school, post-secondary school, transition, we often talk about, you know, how are you going to do the college interview? How are you going to do your schedule for your classes? Well, the other things should be in there, you know, how are you going to contact and when are you going to contact disability services and what does that look like? You know, if we back it up a little bit, we're talking about interviewing and evaluating schools, you know, are you going to go meet and with the disability group? And how did you feel about that group when you talked to them?
Right.
You know, what sense did you get? Did you get a sense that there's support there for you? And so that's an important thing to do.
There's also the important thing of looking at what the health center can provide for you. Right. In a particular college. One of my kids has severe allergies and was receiving shots for them, mm-hmm. but had one time an anaphylactic response to it. And when after she got to college, found out that the health center did not have the equipment to be able to handle right. it. She ended up having to go off her allergy medications, but she had severe allergies at school, because there is no provider within 45 minutes that would right. give her medications. Should we have known that, that should have been part of the transition questions that right. we didn't realize.
Right. And so I think this is the conversation, you know, when you're talking about what are you going to ask the school when you go for your interview, these are really the things that you can bring up. How are you going to continue your disability services? You know, go there. Go to the health center, make sure that everything you think you might need, and you could potentially make that list up with the nurse. right? So spend a little bit of time with the school nurse. She has the file. She knows what your healthcare treatment is, and it doesn't bring everybody in the room into every little nitty-gritty bit of information about your healthcare that you may not want them to know. So we had an issue. Another thing to think about is when kids go out of state to college, can providers bill? So it was very funny. You know, we thought we got this. My son was going to continue with his speech pathologist, and she was going to do Skype or something, some technology we were going to use for it. So I was very proud of us. We were all set to go, and she wasn't allowed to bill because he went out of state, and her license didn't allow her to bill him if he was living at that point in Rhode Island, and so it was complicated, and she wasn't allowed to telecommute conference, telehealth with him. So so those are things like if you think that you're continuing with someone at home in a different state, make sure you need that conversation with them to make sure that those things are at all possible. You know, skills for self-determination, you know, can you manage your medicines? Are you aware of when you need to take them? Can you identify questions to ask the doctor? Again, these are all things that, you know, can be part of when you're looking at self-determination skills. You know, do you know how to manage, you know, your work schedule? Do you know how to ask your employer for a sick day? Do you know how, or personal time? Or, you know, do you also know how to, you know, talk to him about some of the health needs or the impact of your health at work? And that kind of comes in with the self-disclosure too. How much do you tell an employer? It's not necessary. Or how much do you tell the school? It's not necessary to tell them everything, but it's necessary to tell them the most important things. And that's where, you know, work has to be done in identifying them. And as I said, we spend a lot of time with kids. You know, write a list up of all the places you think you might want to go for a job. Can you find, you know, who you would interview with or where you would send that information? Well, you can, while you're working on those things, say, okay, now, when you get to college, can you identify, or when you're working and you're living in a new place, have you identified the pharmacies? You know, these are all just similar questions that you can incorporate into the skill building that you're doing. Self-advocacy, and we've talked a little bit about that in self-determination. Can you describe your disability to people in a meaningful way? And I think that's really the part of it, in a meaningful way, and how it will affect your ability to participate at work and school. And I always throw transportation in because transportation is part of, you know, your transition planning. And whatever your situation, work or school, post-secondary, it's great, okay, you know, there's doctors here and there's this part. Is there a way to get there? And do you need help planning and figuring that part of it out also? So these are ideas. We really don't have big protocols that are written yet, but I think that, you know, part of what advocates do is be a little creative. So I call on you to really try. I'm not going to go too much into this. GotTransition.org is the National Health Center for Healthcare Transition Improvement. And for many of the organizations like myself, National Family Voices, the push is really to use their tools and to consistently use their tools in transition. So I'd like to can I pull up the website on here if I do this? Will it not pull up? Oh, it did. Will they not see it? Okay, so it doesn't work, sorry. So now I will just minimize it and get it out of the way. So I usually when I do this as a PowerPoint presentation, I bring this up. And so my mistake, sorry, I didn't know I wasn't going to be able to do it. But if you go to Got Transition, they have a whole section for youth and caregivers to look at. And one of the big tools that I really like there is that they have an assessment of your readiness for healthcare transition. It asks you a series of questions and you go through it. And then it points out to you where your problems might be in the transition process. And I say to people, you know, a child can do that online with their parent, with their advocate, with their SESP, and then you have some tool to take with you. And you can say, you know what, we did this assessment, and this is where we see things are a problem, and it's because these skills aren't there. And so maybe let's figure out how we can incorporate that skill building into the transition IEP. And I think that, and there's a lot of resources and other little tests and quizzes and things you can take on it, but that's, I think, for everybody a really good starting point, and it gives you something kind of concrete when you walk into the IEP meeting, and it also gives you something if you do it with them to say, take this to your doctor, and let's get your doctor on board. And so to end this up, I think I'm going to circle back to what I said. You know, we're all aware that this is really important. And I think that probably if you've never heard this discussed before, today you may recognize that there is some importance to this. And people are trying to affect change, but it's not happening quickly across the board. And so I really do believe that parents and advocates can be the change agents. They can bring this information forward to IEP meetings, to physicians, and really, and I know we ask parents to do a lot, but it's kind of our job. You know, I think as more people do this, it will become more commonplace then in pediatric practices and also in school districts. It will start to raise their awareness of, okay, we need to think about these things. So thank you very much for listening. I appreciate it.
We do have a couple of questions.
Okay.
So a response from the second question. The person was referring to, who asked the previous question, was referring to social and emotional challenges that might need support in understanding the need to continue health management, taking medications, or the need for health insurance in the future. Who at school would provide this support?
So I think that would probably fall under school counselors.
Okay.
But I think, you know, as part of the IEP team and pointing that out, it's interesting, you know, to think about this. You know, when you look at the health frameworks for the Massachusetts curriculum, part of them are to teach students so that they can manage their decisions and manage their choices for healthcare as, you know, beyond school. And so it's interesting because it seems to exist in the curriculum and probably is part of a general conversation with kids. But I wonder if there's a way at IEP meetings to discuss the fact that a child really can't appreciate that information, perhaps in the health education setting. And maybe depending on the situation with your school district and nurses, there are some wonderful, wonderful nurses out there. Maybe say, okay, so could we set up some time to further that discussion and have that discussion with the nurse? And I think it's really important for these kids to foster relationships with the school nurses. That usually does not happen. I mean, I have to say, my son was on an IEP. I don't think I knew who the school nurse was most of the time. And I think that was, looking back, I think we could have done so much more if I had. So whoops. But it wasn't a good look. It wasn't a good look for me. But I think that's a really important relationship to think about fostering. And then the school counselor. But I think where you can help is helping them frame the understanding of why this is so important. Why this is so important.
Okay. I have one other question. Do schools have to provide a written plan for this health care plan? They usually say the student has an IEP but doesn't have the specifics. How to ensure that it's being implemented in cases that schools don't recognize and or refuse to?
So I think you might be talking about the individualized healthcare plan,
yes,
which is a separate document from the IEP. The individualized healthcare plan is not regulated by law the way the IEP is. So my experience has been that it's somewhat district dependent how they do it. I have said to parents, if you have concerns about your child in school, specific concerns, especially in a certain situation, if this happens, what happens next? So in a medical situation, you know, if my child has an allergic reaction, what's going to happen? But you can do that also with any disorder, mental health disorders. If this situation arises, what do you do? And so I think the thing to consider is going to the school and, again, using the school nurse and saying, okay, fine, how do we put a plan together? I'm really concerned about my child's safety. I think that's always a way to go. You know, I'm really worried. I just want to make sure I can help anyway, that we have this plan in place. Most schools have to write it out, but then I would follow up with questions and I would say, you know, who have you trained? So if he's in English class, what happens? If he's in gym, what happens? How have these people been trained? So I think, again, the schools are not mandated. They need to fill out an IHCP, but a lot of that is left to district to determine exactly how they do it. So again, the parent needs to be the one who kind of says, can we formulate a really good plan? The IHCP does not have to be attached to the IEP, and most districts will not, because any document attached becomes part of the contract.
Mm-hmm.
And so I understand from their perspective, sometimes that would mean every time there's a medication change for a child, potentially, there'd have to be a meeting. But if in fact the IHCP is necessary for FAPE, and if you can show that connection and that it can be referenced in the IEP, it's the same as attaching it. So that's something else to consider.
Great. Thank you very much, Pat. That was great, very informative. I learned
you.
a lot. I think everyone else did as well. I'd like to remind everybody that you will receive a follow-up survey, which we asked you to complete. We value this information so that we can provide everyone with the most effective information to support the wonderful work that you do in supporting children. As a quick reminder, please remember to sign up for the February webinar regarding juvenile justice in the mental health system, presented by Derek Kaiser, CEO of Fresh Start, A New Way of Living. Thank you again, everyone, for joining us, and have a great day.